And welcome back to Comcast NewsMakers. I'm Steve Swatt. My guest this segment is Eric Brown, who is the CEO of the California Telehealth Network. Thanks for being with us.
Thank you for having me.
For our viewers who are not familiar with this network, just explain what it's all about.
Sure.
It's really a sort of cutting edge in terms of delivering medical information, really.
It is. The California Telehealth Network is a statewide broadband network dedicated to healthcare delivery. Our focus is on rural and medically underserved areas of the state. So when we say medically underserved, we generally refer to urban areas where there aren't a lot of doctors or a lot of healthcare providers. We're funded through the FCC's Rural Healthcare Pilot Program, which is a subsidy that essentially pays 85% of the cost to provide broadband connectivity to eligible healthcare sites all over the state.
So you're talking about hospitals, doctors, clinics?
Right. Hospitals, clinics. Most of our sites are rural and clinics, community health centers, critical access hospitals, places where the underserved, frankly, a lot of the uninsured will be treated. And using broadband technology, we enable these patients to be seen remotely by physicians at the state's best medical centers. So if you're in rural California, you come down with a condition, you need a specialist. The specialist is not likely to be in your rural area. Instead of transporting you to one of our major cities or urban areas, very often you can be examined and diagnosed from your local community using broadband technology and high-definition cameras. So,
and this is just for face-to-face or during surgery or both?
Most of it now is what we call teleconsultation. So it's basically video conferencing, high-definition video conferencing technology where the doctor can examine the patient, see the patient's facial expressions, which works very well for things like behavioral health. Dermatology is another popular use for telemedicine, so we can examine skin conditions, in some cases using scopes and those kinds of things. Exchange of patient records. Since our network is a private network, the traffic that travels across the network never gets exposed to the public internet. That's very important when you're dealing with medical applications and patient records.
Mm-hmm. What kind of impact is this? I know you've only done this for about a year so far, but what kind of impact is this having on healthcare costs?
Well, it will dramatically reduce healthcare costs in a couple of ways. One, it prevents having to transport patients unnecessarily to the major urban centers. Secondly, for the most chronic conditions, which generally require a lot of follow-up visits that very often people don't make if they have to travel great distances, the quality of care is improved because it's easier to conduct a follow-up visit using telemedicine, video conferencing technology than if you have to get in the car and travel 2, 3, 4 hours to see the doctor. It also reduces the number of unnecessary visits because if you're diagnosed appropriately the first time, there's no need for you to continue to see multiple doctors. And it keeps, what we know about a lot of the underserved patient populations, when they don't have a doctor or access to health care, they go to the emergency room. Right. It's the exact worst place they could go. It's, first of all, the highest cost of care. But secondly, you can be exposed to other diseases and conditions. And so
by then, quite often, it's too late.
That's correct.
Right.
That's correct. So it really has the potential to impact the delivery of care.
We only have just a couple seconds left. How many sites do you have connected now? And can we expect more in the future?
Very much so. The target is to get over 800 sites. We've got 150 already connected.
All right, that's great. Eric Brown of the California Telehealth Network, fascinating project, especially in those rural areas and the underserved urban areas. Thanks for coming by and describing it for us.
Thank you for having me.
And thanks to our viewers for watching Comcast NewsMakers. We hope to see you next time.